días a todas y a todos. Les
Good
damos la
morning, everyone.
bienvenida a este encuentro
Welcome to this CIESS session on artificial intelligence, a topic that is increasingly present in everyday life. We are pleased to welcome experts, trainers, students, and interested parties.
información sobre la materia.
The availability of abundant information on the subject, which shows its application and use of different fields, and whose importance and transcendence is becoming increasingly relevant in our realities due to its potential to transform them. Computer programs that emulate human conversations, automobiles with the capacity to move autonomously, digital platforms that suggest songs and films are some of the many manifestations and expressions of a type of artificial intelligence. However, its potential exceeds these limited manifestations, which is why the CIESS provides this space for information analysis to address the enormous potential of artificial intelligence to improve the processes and responsiveness of institutions. And this is the subject of the activity, to link the artificial intelligence to social security. Over 60 years ago of existence of the Inter-American Center for Social Security Studies, it has contributed and provided with education and training to officials of its member institutions with research products, as well as organization of activities that bring together specialists in the different branches of Social Security. This has been implemented with a strong belief that innovation and adaptation are a constant in the face of new social, technological, economic, and labor conditions of our times. Information and communication technologies, prospective planning, labor markets, transformation by digital platforms, or digital knowledge management are relevant topics to the training and research agenda of the Inter-American Center for Social Security Studies. The previous year, we have implemented a course to provide employees with the fundamental knowledge to understand what artificial intelligence is, how it works, its scope, its limits, and the challenges it poses.
Del curso Inteligencia Artificial en la Seguridad Social. Y tiene por propósito de generar un espacio de interacción.
Its purpose is to create a space for exchange between experts and participants in the application of artificial intelligence to combine theory with practice, which is aimed to the public so that we can better understand these technological tools. Its decision-relevant topics will be discussed about the regional outlook in which we are now regarding the use of artificial intelligence. In today's sessions, relevant topics will be discussed about the regional outlook in which we are now regarding the use of artificial intelligence, the minimum infrastructure conditions that every organization must consider for its incorporation, the competences of human talent, the regulatory frameworks, and the ethical guidelines for the appropriate use of artificial intelligence. In the face of the great technological changes being made by microprocessors, the Internet of Things, big data, robotics, and artificial intelligence, innovation and information-based management are of fundamental importance. By using these tools, our institutions can offer better services, be more efficient, and ensure that resources reach those who need them the most. Therefore, artificial intelligence should not be understood only as a tendency. It should be noted that Latin America and the Caribbean's response to the great technological transformation that artificial intelligence entails will involve not only the incorporation of chatbots, where people's demands are met or where the issues are not resolved, or to incorporate automation to disengage us. We must recognize that these types of technological innovations require us to systematically generate innovation, to build capacities for digital age so that these technological tools can transform the dynamics of our societies. The development of artificial intelligence in our region will require high levels of collaboration and strong institutional leadership. By harnessing data, can help identify specific trends and situations faced by social security institutions to be more transparent, accountable, and citizen-centered data governance is required. All this is indispensable and important to embrace these benefits of the digital revolution in the effective functioning or operation of all social security institutions. I would therefore like to take this opportunity to thank our expert guest, Ms. Marina Ridao, co-founder of the Program for Technological Innovation in Public Health, Faculty of Medicine, University of Buenos Aires. Mr. Rodrigo Duran Rojas, Executive Director of the National Center for Artificial Intelligence in Chile. Dr. Oliver Azuara from the Inter-American Development Bank, and Dr. Maria del Carmen Macias, Professor of Labor and Social Security Law at the University of Malaga, Spain. Their analysis and considerations will be very useful to understand the significant progress and potential opportunities that the incorporation of artificial intelligence in social security organizations entails. Without further ado, I'm sure that the exchange of experiences will be beneficial and will lead to new perspectives for the future of Social Security in the era of artificial intelligence. I will now give the floor to Mr. Carlos Ivan Garcia Diaz to continue with activities planned for the meeting. Thank you very much, and Mr. Carrasco, for your welcome speech. And again, we will appreciate all the experts and the speakers that are joining us today in this session, for which we established contact via email, and they manifested the interest to participate with us. According to the main, I will just read a short description of the background of this activity, and of course, the discussion between the experts in this topic. Without further ado, the incorporation of artificial intelligence-based technologies in social security institutions presents or provides significant progress and potential opportunities. While some organizations have begun to explore and adopt these technologies, there remains considerable scope for their implementation and optimization in this essential area for the well-being of individuals and their families. AI is now being used in a number of areas of Social Security, from automating administrative processes to improving diagnostic accuracy in healthcare. Now, the intelligent chatbots, as Mr. Carrasco mentioned, and also the machine learning systems are being integrated to provide more personalized care to users. While the algorithms and the big data analysis are helping to identify patterns and trends to improve decision-making in resource allocation and planning for the delivery of social services. Despite such a progress, there are still important challenges that need to be discussed in order to maximize the benefits of AI in social security institutions. One of the main challenges is to ensure the responsible and appropriate use and management of people's information, especially in a context in which the inputs that feed AI systems involve significantly sensitive data. In addition, there is a concern that the implementation of AI may exacerbate inequalities, failure to adequately address the access and equity in the use of these technological tools. And of course, this may result in the exclusion of vulnerable populations such as the elderly. And for this reason, it is essential to ensure that AI is accessible and affordable so as not to create additional gaps in the technological transformation of Social Security service and the transformation process. And another important challenge is the development. We should develop the technical knowledge and skills needed to make the most of AI technologies in social security institutions. And of course, this involves both training professionals in data management and implementation or interpretation and raising awareness of ethical, the ethical and social implication of AI in our context. Of course, with this context and this background, the main objective of this discussion of this session is to delve into the opportunities and challenges of implementing artificial intelligence-based technologies in social security branches. In this case, we will review certain cases of certain institutions so we can improve the comprehensive knowledge and how the artificial intelligence can be used effectively to improve social security services. And first, we will begin with the first part of the session in which every participant will have 15 minutes space. And after this, we will have a space for a Q&A session in which we can answer all the questions necessary by the participants. Okay, just without further ado, I will pass the floor to Ms. Marina Rida, for which I will read her curriculum. Dr. Marina Rida is a medical doctor, especially in public health and master's in public health from the university in Argentina. She evaluated the impact innovation for the research and doctorate in public health, for the technological in public health for the Faculty of Medicine of UBA. Researcher and a professor in public health. And she's also a co-founder of the Program for Technological Innovation in Public Health at the Faculty of Medicine of Argentina. It permanently has a international financing for the Worldwide Bank. Previously, she coordinated the research area of the Networks program, co-program with the international funding from the Development Bank. And of course, she's an academia researcher, a co-author of the several research studies and books in public health and digital health, director of strategic development projects, and Salud Investiga in Argentina. Thank you very much. Welcome, Ms. Marina. Thank you very much for this introduction, and also thank you very much for the invitation. I have some slides for you to share, so let me just share my screen with you now. Okay, please let me know if you can see my screen. Good morning, everyone. Carlos also read my introduction for me. And the important thing is just to continue talking. I will do my best to have an exchange of ideas and discussion and to have a improvement or the better or fruitful discussion today. Let me know if you can see my screen, please. Yes, we can see the slides. Yes, we can see it now. We can see the session. And today we will talk about a certain requirements for the application for artificial intelligence in the healthcare sector. While I was preparing these slides, we had to talk about the certain public healthcare policies and also for the applications of artificial intelligence that are currently implemented. And this is very important because in this space, we can just discuss in regards to all the applications that are linked to address the healthcare or prevention of healthcare based on a community, a population field. So we will talk about the early diagnosis or prescription, and as you know, the use of images or the support for the clinical decision making. And of course, we will also talk about the applications linked to the public health and the management of services. And in this slide, we have a diagram for a proposal for the essential operations and functions of the healthcare, the public healthcare. In this case, we find four important items: the access. Okay, let me know if you can see it now. So we have four access, which is the access to the management for Social Security, healthcare. And also we have the resources allocation that has to do with the management of system in different sectors of health. And in this case, we have the access to services, comprehensive services for quality, financing of health, and management of human resources. On the other hand, we have also the evaluation for both monitoring, evaluation for public policies and the health risk management as well. And of course, we have the development of policies, which is fundamental in the public health sector. In this case, we include the regulatory frameworks, participation, mobilization of society. And I'm covering this because in just in a few minutes, when we start talking about the different methodologies of artificial intelligence, this is very important because even though I just focus on this field for new technologies, I would like to provide you this information as an axis of the applications of artificial intelligence. In this case, artificial intelligence is a wide a topic that covers different kind of technologies. As I mentioned previously, they are very useful to recognize patterns or just to make projections and to improve the data analysis. This is a fundamental thing for the public health because we need to analyze information or complex information from different sources. And before we can talk about the methods about these applications, I want to comment the main principles of on the usage of interpretation of the usage of artificial intelligence in public healthcare. These propose a certain principles for application of artificial intelligence that are very important to consider in this discussion, which is to center people and just to consider their rights, of course, based on the ethical that are based on international consensus, to be transparent, to be open, of course, to share the personal data, and not to be discriminatory, to be, of course, controlled by human beings. These are the principles on the artificial intelligence usage. And the field of artificial intelligence covers a lot of methods to resolve or to address a huge number of problems. And within this diversity, we have genetic algorithm, neural networks, or research algorithms or systems based on rules, of course, in which we have machine learning, which we have here in this slide. Within the machine learning, we have three different methodologies, which are the automatic or machine learning, in which of them are the unsupervised learning, this unsupervised learning, supervised learning, and the ones which is called reinforcement learning. And the supervised learning are used in the healthcare sector, and they are the ones that just log data to start learning and just to resolve some issues based on the previous logged information. In the other hand, we have the unsupervised learning, which are more comprehensive. In this case, they try to discover patterns that are hidden by a certain not identified data. And the reinforcement learning doesn't require a list of set of information, but this operates into a dynamic environment due to the required or decoupled information. And within the operations of the public healthcare, we will see three, within the four platforms we will see three of them in which they are already applying different technologies of artificial intelligence. Some of them are within the phase of publication or to be validated. And of course, just to have all the tools, because not all the tools are being implemented. And of course, they have to link the principles for the law. And of course, within this public administration or this public healthcare administration, we have the precarity of artificial intelligence. In this case, there are certain fundamental which applies in all the artificial intelligence applications that are being used. However, in this case, for the management, for determinants of social and the prevention of healthcare, and to predict the good healthcare habits, the language is incorporated in this field. So in this case, they have to use models with different languages that are increasingly developing. And of course, we have the support for the WHO, and I will provide you with the link of this application. In this case, this is implemented by application. And this is a virtual assistant that has been addressed by the WHO that can be reviewed, in which you can also interact. However, we have some other usage of artificial intelligence in which we use clinical history data to know certain aspects of the social determinants of the population. And there are models that may be found and identify the 33% of patients that can get adverse diseases based on that record. And some of these experiences that I am just talking about today. And of course, there are some other algorithms that are useful to predict are for the depression, for example, and as I mentioned previously, for the chatbots and the virtual assistants and these models of interaction. And this aspect is very important for me because it's in which we have greater progress on the artificial intelligence usage. And this access of the essential functions of public health. And this has to do with the management and allocation of resources. The machine learning analyze and the big data analyze greater number of data in a more efficiency way, so they identify patterns. In this case, we can start working in the prediction on the demand or just to optimize the workflows, and of course, to implement more application for optimize the workload in certain locations. And of course, certain that includes the demand is when we can know which are the peaks of demand, how to organize and to change the service organization when we anticipate to that demand peaks. And of course, in the workflow, just to identify the blockage or the blockchains are not allowed to continue progressing. Likewise, these models are useful to detect frauds because they detect patterns. They also detect the malicious patterns. So this will allow us to find anomalous or bad things within these algorithms. And of course, within the administrative of healthcare institutions is very useful. And in the last axis, before we conclude, I would like to mention that I worked a lot in this topic on the technological surveillance and the usage of Social Security for the detection for certain outbreaks. Because this principally they use basic tools. However, now we can add or we can include based on machine learning. And of course, with many sources of information are more easy to detect viruses for different sources by local network or the viruses for the residual waters or the hospital incomes or certain other information. This information can be analyzed based on the pattern on a disease, for example, or transmissible or portable disease that can take or can get into an outbreak. So the usage of technologies are very useful to make decisions based on the information and data. And just to conclude, one is certain challenges for that artificial or implementation of artificial intelligence covered as follows. We need to we have to change the transformation of digital transformation in public sector because we need information, a lot of information from the total number of the system. There are certain parts that are already implemented and we like information of this. And of course, we have another challenge, which is, and I will talk about this later on. We should know what the outcome means because the treatment that we can be provided to the results, for example, just to mitigate the biases, this aspect is very important in public healthcare because the algorithm bias can just change the inequalities that we can find or face nowadays. So this is a very important challenge. And lastly, and just to resume what I was mentioning previously, is just to implement the governance for data for the public institutions because we should enhance the capabilities of analysis and public administration. We should strengthen the digital competencies of users, but also the management competencies of the digitalization. Thank you very much. If I just take some minutes. Don't worry, Ms. Ridao, no worries. We can just take advantage or leverage of the minutes that we have. Thank you very much for your intervention for the implementation of artificial intelligence in public health care. And of course, the machine learning is supervised and unsupervised healthcare can be improving the identification of certain patterns. And of course, that we should consider the algorithm bias. It's something that we are going to talk about in the QA session later on. And of course, no worries. We want to just manage all the discussion and the feedback between all the experts, and of course, for all the students and all people interested in this topic. Okay, now just to confirm if Mr. Rodrigo Duran is already here with us. Thank you very much, Mr. Rodrigo Duran, for your participation, and we will pass the floor. However, before we will read your curricular resume for you, and then we can continue with your intervention. Mr. Rodrigo Duran Rojas holds a master's degree in economics and public policy from the Universidad Adolfo Ibáñez in Chile. He previously served as Chief of Staff of the first Undersecretary of Science in Chile. He is Executive Director of the National Center for Artificial Intelligence, CENIA. He also is an executive director of the Latin America Artificial Intelligence Index, published in August 2023, which provides a comprehensive analysis of the state of AI in 12 Latin American countries. Co-chair, co-CEO of the Talent Table of the Senate of Republic of Chile, and co-chair of the AI Working Group of the Digital Agenda ELAC. Thank you very much. We will pass the floor for you, Mr. Rodrigo. Thank you very much. I am not able just to turn on my camera. However, we have to change the time on Saturday. I'm so sorry if I just am here late. We can see it now. Thank you very much.
Mi presentación del día de hoy es factores
Okay,
habilitantes.
the main topic of today's session will be the factors for AI. First of all, I would like to thank the CIESS for this presentation invitation, for being able to participate in this session. And of course, for all people that are joining us today and all the people that work in the development on this. And of course, we have here some images for the person that can collaborate for the first version that are integrated in this session. And just to mention, this is some work that present to CIESS, in which we just act as a managers or actors for institutions that have the interest to understand what had happened with artificial intelligence in our region. And basically, I want to explain what was the objective of this, because it was based on the presentation analysis of the state of the art and the practice of such artificial intelligence in Latin America, because this is basically, this information is available already. And the researchers found that, unfortunately, this information was located in a south location in United States. However, they've been able, they're facing certain things. So they wanted to talk about the challenges to the usage of artificial intelligence, and they wanted to know what will be the start of the real dynamic of this. And for this issue, we center into a three-dimension of analysis in which I will start my presentation, which are the factors in research, development, and adoption, the development of artificial intelligence in each of the countries, and of course, a part of governance, to understand, which we're understanding how the development of the environment influence in the institutional development of AI. And of course, we have the perception of this field in the future scopes for the American Latina, what is the risk on the usage in this matter. In this case, we constitute the index based on the secondary data, in which we used data already available and validated by an international organization that were out of Chile. And of course, these subdimensions were implemented, were divided in certain other subdimensions that constitute the dimension or the factors of the AI. And also the research that you can find into this document are secondary methodologies that are already validated and executed by institutions that are experts on this field. And according to the context of Latin America, it's not considered to know if it's already good or not for certain locations of Latin America. However, we can have a concrete research on this sense. This is a make objective that we provide while we get this kind of information set. And of course, just which is the topic of this presentation, which are the enable factors for AI. And we have considered, we find four of topics. However, the main debate is just to identify it is important just to know that artificial intelligence can be developed in an appropriate way, either in any sector, either social security, healthcare, education, etc. The first factor is that the state and the communities has to have capacity or training in computing and to execute complex models because the clouds are just storage tools that need data. And this element is very important for both be trained and also just to execute once it is trained. The second part, we have talked about this later on from the 21st century. However, at the same time as an oil, this is implemented in a more equitable way. However, we have just to, this is not to implement this because we need a appropriate governance to not to provide, or not just to see the privatization of this in different scenarios for the population. And of course, this is implemented to get into certain ideas or solutions for the social security institutions and not to break the human rights into the privacy of people. And also we have another factor which has to do with the human talent. In this case, we have to develop the human talent to develop them or just to train them and to understand what is happening now. So there is a contrast to distinguish that a enable factor has the possibility to develop or just to leader certain processes. No, because at the end of the day, the people are the main objective of this. So we should be able to know, to understand what is happening with the data and the outcome this will provide us. And first, just finally, as you may know, in Chile and Mexico and some other locations, in this virtual audience, the connectivity is a fundamental right to continue working with digital models, of course. This not only has to do with to have computing system, however, we should have this connectivity to interact and to access to different fields. And just as a general framework, this is a thing that we consider three enabling factors, which are development, governance, in Latin America, because Latin America is a diverse region. However, there are some other countries that don't have enough development in this field, but I don't know either country that doesn't have a development in this artificial intelligence. However, there are a lot of information that is still to be implemented. As enable factor, we should have talent, people, or to have competent people to continue developing with different models. In this sense, we implemented 4 of them, considered in Latin America, just to understand the talent leakage, because this is near of the 6% of the authors or people that are trained in Latin America, and they ended up publishing out of these countries. So we need insertion spaces because from Latin America, we go to the more absolute space, not only for the authors, because the authors had been progressing out of Latin America. In this case, they reached the 58% of people out of these countries. And of course, this is an outcome that shows in these locations there are people that are just going out or just go out from this field, and the majority of the authors have the prevalence of more than 50% or less than 20%. And of course, we have some other authors like China that work with the private sector. And the second relevant factor is the governance of data. In this case, we have observed that we take the availability factors or data for the usage of information. However, we can see that it has a good development. They have a reach near the 60 points or 60%. However, when we observed in the usage of data, something that previous doctor mentioned, we have a gap in almost many countries. And as I mentioned, each of these conditions are not enough but necessary for the artificial intelligence. And so we ask ourselves if we are having a good infrastructure for the usage of data. And the main answer of this question has to do with the absence of computing and the lack of connectivity. However, there are some other fields that they have huge capacities of data because they have national capabilities. And due to the lack of infrastructure, some other countries, they have the lack of connectivity, and we are not able to leverage all the important tools that we have in hand. And of course, another point has to do with the labor force, all the people, they have to be talented. And we have observed the presence of skills associated with artificial intelligence. There is a line that has the division on the implementation or the average usage of artificial intelligence worldwide. However, in Chile, we have some other lines that in which we detected that in the average, the Latin America is in the 6% less progress in comparison with some other countries in Latin America. So if we compare the Latin America countries with some other countries, Latin America have lower capacities in this. Of course, there are some other cases of success in the region, and Mexico has almost the same situation of Chile. However, we have a relevant gap in terms of the training and capacities for the on artificial intelligence in the human talent. And some other element that is also very important has to do with the capacity to converse within disciplines. As Dr. mentioned, because there are systems that are very complex, so they need a transdisciplinary management. And in many countries of the region has a transdisciplinary conversion with a higher level. And of course, there's some other publication of artificial intelligence. We can only see a greater productivity associated with the multidisciplinary or for the process of technology of the humanities, and or the usage of artificial intelligence has also the 2%. And some other enable factor that we didn't mention in the research, but it is relevant to mention, is it relevant or division and institutionality as a normative or guideline for this. Because many countries that have a huge level of this, they started earlier in the development of strategies and vision of own artificial intelligence with data. And this has been very favorable in the development with other countries. And of course, we cannot see if things are made than others, but they have identified this when a nation is capable just to gather together and to agree on certain direction of artificial intelligence. This will allow them just to face the challenges with greater capacity, or with greater coordination between the stakeholders. And lastly, I would like to know that it is not integrated in the enabled factors. However, it's important to mention. It's important to develop elements, to develop elements of artificial intelligence has to do with the skepticism versus the optimism. And we have found here a test in the digital media and communication media. And we find that we develop more than 37,000 million of messages in social media. And in average, in the social media have more optimism than the perception of digital media, because the negative perception of digital media has a third or a quarter in contrast or versus the social media. So in this case, the society conversation on this kind of networks cover different kind of topics. So, and this is it of my presentation. Thank you very much. I'm sorry, and I apologize for the delay, and hopefully we can continue talking on this session. Yes, of course. Thank you very much for your intervention, Mr. Rodrigo Duran. It's very important just to highlight this research on the development of artificial intelligence, which is a huge point just to focus on the regional environment, to consider this as conditions to leverage the potential of technological resources on these capacities on the computing system. Of course, just to provide or just to analyze these complex systems on the governance of data and the human talent to train these models. And mainly for the capacity of connectivity on the region to leverage them, of course. So we already have some questions on the Zoom chat. However, we will answer this at the end of the session. Thank you very much. And now we will pass the floor and we will have the participation of Mr. Oliver Azuera Herrera. Thank you very much for your time. And now I will read a short description of his professional history. Dr. Oliver Azuera Herrera is a senior economist in the Inter-American Development Bank from 2017, where he leads operations and research focused on the future of work, digital skills, digital social security, and the evaluation of the effectiveness of labor policies. And of course, he has worked on how labor markets have evolved in the post-COVID-19 technology adoption. He holds a coordinator position of the Inter-American Development Bank in Digital Social Security Lab and Labor Observatory. Mr. Oliver joined the IBD in 2012 in the Office of Evaluation and Oversight. Prior to joining the IDB, he worked as a researcher evaluating the effect of social protection programs on labor markets and designing impact evaluations on financial education and pensions in Mexico. He has held various positions in Mexican public sector and also worked for the World Bank for the Center for Development Research. He has a degree in economics from the Instituto Tecnológico Autónomo de México, ITAM, a master's degree in public policy analysis and PhD in public policy labor economics from the University of Chicago. We will pass the floor for you, Mr. Oliver. Thank you very much for the invitation. Let me just share my screen now. Could you please confirm if you can see it now? Thank you. Thank you very much. Everyone, thank you very much for the great invitation by the Inter-American Center for Social Security, Mr. Dr. Carrasco and Mr. Carlo. It's a pleasure to share with you in this panel and participating on this event to contributing on the analysis for the region. So this is just a short presentation in which we will have three important items, which is the data of AI and the AI in Social Security, and what is the main purpose of IDB. As the previous panelists mentioned already, the data are the base for which we can just operate the artificial intelligence. However, will be the existing data to have enough data and for quality for the great functionality operation of artificial intelligence. The first challenge is the quality, because artificial intelligence with data is able to provide enormous errors. However, for the bad characterization of people or some other strategies. So just to make an analogy, the usage artificial intelligence with data with low quality is just to have an electrical car without charging. So in this case, it's important to have data of quality just to maximize the potential of artificial intelligence. Then we have the scalability, which has already mentioned, because artificial intelligence needs huge number of data. The infrastructure of the information technology or traditional IT infrastructure require updating. And the main challenge is that, of course, the numbers that are already presented, the scalability not only is dedicated to the process of the information, just to process them effectively, however, just to provide them with the value. Because artificial intelligence requires the updating and inversion or investment of data just to provide us with information or valuable information for which we can make decisions. And of course, we have been talking about the integration of databases, because in this case, we have to integrate different information from different sources for the implementation of artificial intelligence. In this case, it's just to make a puzzle in which is based on different set of information. And of course, these sources from different information lack for information. So the main objective is just to get into the operation and how they can work together in that to have to make decisions for the registers of the record of this information. And of course, the privacy of data is a critical element because it would make mistakes or in the infrastructure or digitalization of data, or just to make the mistakes in the privacy of people. Of course, if we would talk about the privacy of data, we need regulatory requirements because it is important to have an ethical responsibility, something that the bank is doing nowadays. Now, the processing time to get the information is also a critical metric for the efficiency in which we operate artificial intelligence and also for the processing of data. It is not only just to continue working with the scheme. However, if we are not this implementing on time, this is over. We are just facing the changing of technology. So this is only the context for you to understand where we're talking about. And of course, what is the main objective and how can we implement this in Social Security? Because the richness of that in Social Security institutions is huge. First of all, this information has been recorded on paper or in electronic or manually. The important thing is to this information just to know how to interpret them, and which is very important in this process. First of all, the data. Because artificial intelligence can help us or support us a lot for a better management of the resources of the recovering of benefits from which we provide all the services or the insurances that are financing by the institutions. And nowadays, all the programs or systems are integrated by the systems of the labor market. So this is very important because it's cheaper just to provide this information to get this process by the independent or the people to have correspondence with their obligations. However, artificial intelligence allows us to identify patterns or frauds or identity robbery or some other benefits because it's greater in the decision-making process because previously was more difficult to have a dual decision in contrast or versus artificial intelligence provides. Now, then we have the evaluation of risk because the artificial intelligence helps us to evaluate the risk of people on the way they can receive the benefits. We can have here the evaluation. We can make some precise evaluation for the risk of people, even just to make specific estimations on what are or what will be the main primes that should be covered in an extreme case. And also we have mentioned of the service or just to customize services. For example, the chatbots and the usage of artificial intelligence. These chatbots provides information or support us just to provide information customized for the client or for the request processes. In this case, some repetitive task they are not required to be processed by a human, but this analysis can be designed according to the needs of the population. And of course, in the virtual assistant can just answer certain information to provide information about certain services in the healthcare or topics like pensions or the benefits. And also we can make a productive analysis. In this case, we can analyze historical data and to predict the demand of the benefits for Social Security and healthcare or the geographical transition of the population. It will be very useful for us to see substantial information on what are the financing status of the Social Security institutions. Therefore, we will be able to create the profile of this population to reduce the probabilities for them to have existing disabilities or ILSs. And of course, not to affect these Social Security processes. And also for the insurance Social Security institutions make use of this technology. And in other hand, we have the automation of administrative tasks, because we can automatize different repetitive tasks and are very important for Social Security or social protection processes. By investing, or if we make some higher investing that with the time are being diminishing. In this case, we can just make some complex processes for people to make use of the benefits. And also we have the intervention for vulnerable groups, which are very useful just to have the analysis of the income or the state of income, and just to provide them a profile, a financial profile that will allow us to make more incentives or very incentives for them, and to recognize or to acknowledge that they are making a huge or great work, and also to provide interventions in the vulnerable people. And within the bank, previously, I would like just to introduce for you with certain tasks that we are operating here, and how we can use the different tools, because we use artificial intelligence just to identify analysis or skills by analyzing whatever is in the network. Because we need, of course, all the information that are provided by other institutions, and we use an automatic language model to know what are asking by the private sector, and just to provide all the demands or to cover the demands by the public sector. In each way, we can find what will be the main points for which we have to focus more, and use the technologies to know the total of digital skills and total number of social emotional skills that are developing in this sense, or the vacancies. And also we have another example of Robot Laura. And this is good for the identification or early identification for certain diseases, or the early identification. People may have a sustainable benefits for the previous prevention. And with this, we have tried to have lower number of people with this prevention, or just to lower the number of mortality in people. In this case, we have saved more than 24,000 lives of the people. And also we have another example, which is fear-like. In this case, we focus on the usage of how the usage of the ethical way of the usage of data. And this is just to promote the responsible usage of technology, and just to support the regional governments, and by applying this technology, by reflecting the values and the systems that reflect the institutions. And of course, just to make certain implicit things, but however, it's important to cover by them. And the governments and the entrepreneurs that develop these systems, they create certain other systems, because it's important to know how they think and what are the outcome, or what are the results that they expected to have. Because of course, not all the outcome has to be obvious, and what are the risks that are covered by using this. In case of the government, or the role the role the governments play in this case, it's possible for them to make use of these technologies. And of course, just to identify the biases and to make something just to avoid that the biases affect the main system, the financial systems in this case. And of course, we have inequalities in the society. The artificial intelligence, in this sense, can reinforce and to know what will be the distortioning or what will be the challenges in the face of this issue. And of course, we have the accountability. The accountability, it's important to have transparency, to have response mechanisms on the usage of these technologies or the data management. In addition, the technology that we are implemented in the bank, we have looking to provide things to people and to use it in an ethical and responsible way to avoid effects for the future technologies, which is our objective. So the technological responsibility had to be the value and the tools necessary just to answer the questions or to apply the questions, which are all already implied with this technology usage, and to apply technologies that can be centered in the human being welfare. Okay, thank you very much for this contribution. This is all for my presentation. Thank you very much, Mr. Oliver. This is relevant. The agenda of the bank is very important and relevant. And to know how we can make emphasis in these challenges on the quality of data, because at the end of the day, they are implemented by human. And just to leverage this potential, we need quality, data of quality, and just to interoperable data. This is one of the great challenges that has to do with the simplification of processes, of course, within all the institutions. Because all institutions, we should have all the clear operation, identifiable operation. For example, as you made the sport car, we don't have all the necessary tools, or just to leverage the maximum potential of these technologies, this won't be useful for us. So we already have some questions and some reactions in the questions and answer session that will be covered later at the end of the session. We are sorry because the next lecturer, Maria del Carmen Macías, has some inconveniences with her connection. She will try her best to connect to the Q&A session. We should have some, she made some judgments, so we will pass to the question and session, answer and question session. We will invite for all the lecturers and participants for artificial intelligence course applied to social security institutions to answer or just to cover these questions. And the main purpose was just to interact with the guest. However, we will ask you to raise your virtual hand in Zoom, and according to the list we have here for participants, we will try to answer all your questions. Okay, so we will try to answer, first of all, 5 or 4 questions, and then we will have the participation for the general public that I will also have to answer all their questions that are going to be delivered in this chat. Okay, if any of you want to start this virtual session, we will start now, and we will just start with this interesting exchange of ideas. Just a second, please. Okay, if any of you want to mention something, just raise your virtual hand. Okay, we have Carla Mora. Please go ahead, Carla. Carla Mora, can you hear, can you listen to us? You have your virtual hand raised. You can just answer the question. Okay, while Carla Mora fixed her technological issue, we have already some questions. So let's just start with this section of the session of 3 questions.
Jorge Reséndiz, adelante.
Okay, we have Jorge Resendiz. Please go ahead.
Adelante, Jorge, te escuchamos.
Please go ahead, Jorge.
Es que fue un error. Discúlpeme, no iba a levantar la mano.
Ok, no te preocupes.
I'm sorry, I apologize. I didn't want to raise your hand. Okay.
Esta sesión, iniciamos con los comentarios en el chat.
Okay, just let's begin just with the questions in this session. Someone mentioned what will be the focus on the usage of the machine learning.
Héctor Ramírez hace también una participación.
And Hector Ramirez also mentioned at the same times of the usage of artificial intelligence for both the public sector. In our case, the Social Security is important that legal lawsuits can work continuously or similarly, because in this sense, is there any proposal or action that is still already in operation?
Heidi Oña también hace una intervención y dice, una inquietud es segmentar por incidencias en la salud pública.
And a concern just to focus the incidences on the public health will is the reduction of expenditure.
Más confiable para tener predicciones razonables en el usando machine learning y cuáles son las propuestas
And what are the proposals or what ethical regulations and legal regulations are identified
que pudieran estar insertas o enfocadas a la seguridad
that can be focused on Social Security and can help us to manage or just to use the artificial intelligence in the Social Security? Any of the experts want to answer this question?
Yo no me veo, y de hecho estaba con el nombre del doctor Oliver, pero ya me lo cambié. Ay, wow.
Ya resolvió
Eso
ese
habría
problema. Ahí
generado
está.
la confusión.
I'm sorry, I wasn't able to open my camera. I have already answered some other questions in the chat section. But in terms of legislation, we're making different common efforts. However, I would like to mention some of the common efforts. And the Santiago Declaration that was considered by different countries in November of the last year because was represented by UNESCO, in which it was manifested the will to have a regulatory framework considering the elements of the development and application of artificial intelligence. Of course, making emphasis in the ethical and the discriminatory biases implemented in this case. And this is something that has been implemented and also answered the concern that has already manifested. On the other hand, we have some other efforts for the CEPAL and the European Union. And of course, this has this geopolitical component in which they considered or they will try to propose certain things in which they want to make some regulations in the terms of technology. However, from my point of view, they were common due to the industry and for the regulation of this artificial intelligence. However, this is a common efforts that are already very implemented in this topic, and it's important also to mention that the elements, the more critical elements, besides the biases that are used for the artificial intelligence, particularly in Social Security, has to do, first of all, with the treatment for the sensible data. Because even though we have artificial intelligence regulation into the updating of the legislation or the data privacy, it's very important to have these regulations implemented. because this is not only the usage of the algorithm. And secondly, we should have the security, the safety to know where this information is to be in storage. And of course, by implementing certain evaluation of the legislation of Social Security legislation and the Social Security data, or just to have accessible this information, we will entail into a violation of this information. And of course, this is the role for the states to know what will be the mechanisms not to avoid the violation of this information, independently of the privacy. Because in this case, we have a greater challenge together. I'm sorry if I'm just insisting this because we should know what are the data that should be implemented in a more digital way. And to implement in the infrastructure, computing infrastructure, for which we can access based on certain conditions. If these conditions are not comprehensive, of course, it will be very filter. We can filter all the information for social security institutions. So for many countries, we have find a challenge, not only for the social security, social insurance, or the benefits. However, we should be able to have an important owner that can storage this information for the privacy of people. Thank you very much, Mr. Rodrigo Duran, for your intervention. Any of the speakers want to participate in this question?
Ay, perdón, fue al mismo tiempo. Solamente agregar iniciativas.
I would like to add the OPS initiatives that are not based on the legislation. However, it's important just to continue working on the original normative. And I agree with this. I'm not going to repeat this. However, I would like to add what Rodrigo mentioned, that certain questions on their data protection, that it has to do with the capacity of our computing to make them anonymous. And of course, the risk for the re-identification. This is evolving with the time, because many years ago, just to provide this anonymous information, they were able just to the documentation. So now the computing capacity is higher, and we have higher risk to re-identify people, or just to evaluate the information we share, and of course, just implement certain things. So we should continue working hard for the capacities that this entails, so the development of capacities or training. And of course, the organizational culture and respect on the private data. Okay, thank you very much, Mr. Marina.
Hay una pregunta sobre cuál es el horizonte más confiable para las predicciones usando machine learning, pues depende. O sea, depende.
What will be the focus on the machine learning? However, it depends. Well, it depends on the prediction. We already have different industries that have different approaches according to the objective. For example, in the case of the OECD, or for the GDP, it's important just for what will be the prediction of Google, or the prediction on the of this depends on what are the existing data available. So this would be a function that will allow us to have greater predictions. And I really agree what we have been said before, because we need to have a safety tool for the data. So this is the spirit of FERLAC, and as Christina mentioned, or in the sectors in which we work at, the main idea is just to continue working, or many answers. We don't know many answers. However, it's very important to continue working with other people that are developing these kind of tools, that most of the times they don't realize the negative potential that they might have. And therefore, what the bank looks for, mainly in the operations that we involve at, is to have the consciousness what the risks are, in addition to continue working proactively in the resolution or the addressing or reduce them as much as possible, and to manage them in an ethical way. I already provide you with the link of the webpage of this sector, in which we can find some other things that are being implemented in my area. And of course, with different initiatives that are implemented in this case, in this field. Thank you very much, Mr. Oliver. And of course, I have identified some other specific questions for you. And we have the participations of Ms. Paula Garnero. Good morning, everyone. Thank you very much for joining us today. I would like to answer that based on your experiences, if you know a case of the development of the Latin American country on a solution that can be applicable for the social security institutions, or an experience of any country that you consider to be studied or to reply or to adopt in some other countries in the region. Because we, with the students of this course, we have been working in a pilot of concrete examples, and each of them, because each of them are using different kind of data. However, I would like to answer if you know a greater regional example that can be considered in this session, and also for a particular example for this session.
Hola Paula, tanto tiempo.
Hi, Paula. It's been a long time.
Son interesantes, pero son bien coyunturales de
I have different examples, however, it has to do with the
colaboración con el
and one has to do with the collaboration with the development center in a hospital here in Chile. Because just to put you with a context, that Chile has a problem in the blockchain in the healthcare sector. And what happened here is that the contact with patient to access on time have a desertion rate of 60%. So each out of 10 hours already scheduled, 6 were lost because people didn't get to their meetings. So we have implemented an automation process or system that have already verified or managed this schedule. And I think we have reduced or we have implemented or we have reduced this gap in 3 patients in 8% because we already have reduced significantly this rate. And we also have a prediction model to cover the solidarity benefit that has to do with the contributive session and for the auto financing pension. In general terms, the person has to the person has to ask for this, and of course, the pension will be automatized. And the system just focuses the effort for the Social Prevention Institute to provide the resources or just to inform the person that they can also cover their payment or just to go for their payment. So of course we have a limited time just to cover this social process. Or there are some other people that weren't able to cover their pension due to their situation. And these are the 2 cases that are very interesting to provide you and also to be scalable in terms of such security institutions. Any of you have any other case that should be very useful for us? If not, I would like to mention on the projects that it has to do with the sharing of information on Latin America, or what will be the legislation that has to do with the research or implies researchers or research in conjunction with some other countries.
de IA en la región.
El proyecto Guacamayo de la Universidad de
For
Los
example, the Guacamaya project in Bogota is also being implemented by Azure Microsoft. In this case, it's very interesting because Microsoft just make to the disposition of many credits for the researchers to start working on these methods. It's very interesting because they mix biological research with some other components and also for the and of course with the backup of the Amazonia by the support by different biologists and scientists. So this is implemented by the University of Los Andes in Bogota, of course. And this has been implemented a lot in this. And their computing systems, of course, are provided by Azure.
Página de FERLAC, digamos, no nada más hay en salud, es
In case of FERLAC, we can not only focus on the healthcare policies on the labor market. However, we also have been working a lot in the educational sector. And principally in the healthcare and the pilot part, the main idea is that they are already implementing them. Specifically in the Social Security, the applications are more focused in healthcare. However, they also cover the administrative field. So in the way they calculate pensions, they have to do with all the infrastructure they implemented because this demand on pensions will be very important. In this case, it will be very important to be more efficient in the due dates or due times for the benefits. We are starting working because due to the bank, we are working with the red flag. However, if we don't have the administrative data or the basic administrative base data in a digital way, it will be very hard for us to continue working on this in the future years. And of course, the waiting times will be lower. In this case, for the Italian hospital in Buenos Aires, they have the informative system already implemented many years ago. And the artificial intelligence application, as Mr. Oliver mentioned, it is implemented or focused in the decision-making for the healthcare because they have a lot of projects in development. And of course, for the symposium of artificial intelligence that are being held year per year or every year, and they're also working in certain things on the administrative dynamic and the optimization of turns. And just to deepen of the application of this, we can choose the contacts that you will need. Okay, thank you very much for your questions, Ms. Garnero. Okay, I think that we already have some participation, some other participations that raised their hand. Okay, let's just exchange or make a symbiosis between the two types of questions. However, let's just pass for the virtual questions. If you all agree, we will try to cover all the questions that we are registering or recording. Nicholas Stark want to ask something. Thank you very much. It's a pleasure for me to welcome you from Chile. I think that in this session of this panel is very interesting on this topic. I have the honor to have a great relationship with the CIESS since I'm the controller of the conference. And of course, this motivated me to participate. And this topic is very important because we should repeat a cycle to continue working on experiences on different institutions. For example, in this case, the example of this bank, it can just replicate this as an activity that can take longer time. In commercial engineering as a profession, however, I have worked in our early times in the informatics sector in Chile. And then for the compensation and fund, and I will say that the tools or the information that the fund has to do with the social credits. And later on, I worked in the development on a project, and we ended up to put available certain solutions for the healthcare and clinical healthcare. So I think that the artificial intelligence is not, it's only the positive evolution on how all the technology has been progressing. And of course, just to find some other virtuous ways to enrich the business in which we implement these technologies. I think that in the healthcare area, nowadays it is necessary to digitalize all the clinical information, of course, mainly for the record systems or all the events that occur. And of course, we can materialize this because uh, I also have been already focusing this. So I'm sure that this information for a insurance company will be not that good because I'm just focused on the insurance. However, I think that the Social Security have two challenges. The first one is just to leverage all the usage, all the tools for artificial intelligence, because we all see that we lack different programs that can just cover the purpose, which is the prevention. And this is where we need a lot the usage of these tools for all the interventions or the preventions that are made either in coverage can be met. I work in Chile in the elderly topics, and this is a novelty. Because we have a huge number of pension wallet, and some of these institutions are covered by the AUHIC program, in which the state, either through the public system or the private system, they provide opportunity, a warranty opportunity and cost when the insurer doesn't comply. The person has to ask for a voucher in the clinic and they have to recover that. So in terms of the elderly, many elderly doesn't have the right for the dental benefit. So it is probable that, of course, as us, as elderly person, we are prompt or we tend to lose our teeth before the 62 years. So of course, we should simulate this in different sectors. So this is our topics that should address by using artificial intelligence, not only in models or packages that are just implemented by default. However, artificial intelligence should be for the service and the purpose for the high strategic business. And when I mention the business, it's like the Social Security has to provide a greater efficacy in the cost and the coverage, because this is the business of Social Security, of course. So I insist on this topic because this topic is important for a near future. And of course, because there are some other institutions that have been developing, and of course, we should share experiences. And through artificial intelligence, I may find in the pension funds what would be the accounts with the people that are provided with the higher salaries. In that perspective, we should develop a mechanisms for this proportion are provided in a good way. And of course, the challenges are just to leverage the maximum of the development of the insurance of the Social Security. For in the way of by the risk, we should have an educational part by including the responsibility for each authority. Because the responsible people, they will have the right and left hemisphere for different purposes, because the right hemisphere has to do with all to cover all the information to address all the needs. And on the other hand, just to be confident that everything will be fine. So in this perspective, I think they are very important to consider these challenges, because the income that we have in our social security institution is just to save lives. So what opportunities do we have here? If the artificial intelligence over the usage of the information, this will allow us to optimize programs for attention for specific groups of the population. Or within my product wallet, I have a patient, healthcare, or family, or occupational risk, etc. We can just provide a special package for the company that is in Chihuahua, for example, so that they have certain specific needs. So in this case, we can make matching. So in this case, that institution, they have to cover these needs in a more efficient way. In this case, we are able just to be more precise for the IMSS, for the ISSSTE, or for many other the institutions of Social Security. In this case, if the CIESS or CIESS gather together and to find a solution, and we can work together, we will find many solutions in Social Security. This is my contribution. Thank you very much. Thank you very much, Mr. Nicholas Starr, for your contribution. And now I will pass the floor to more people. And later on, we can continue with the missing questions in the Q&A session. And then we can just continue with we can cover the whole questions. Okay, we have here Constanza Ganuse. Would you want to ask your question? Please go ahead.
Constanza Ganusa, ¿estás por ahí?
Constanza Ganusa, are you here?
Hola, ¿se escucha? Me llamo Lucas Domínguez.
Adelante, Lucas.
I'm sorry, my name is Lucas Dominguez.
Con el link de Constanza yo trabajo.
I'm sorry, my apologies. I just get into the session with Constanza Ganusa. She's my partner.
Nacionales públicos y de reparto solidarios, como los modelos que existen en Argentina.
According to different models for distribution and them as similar to the models in Argentina, I would like to mention that by the usage of artificial intelligence in this context, when we have a different variety within the life experience expenses and the ages, what models should be implemented for artificial intelligence, either by promoting or just to continue working with this kind of systems that are universal. For example, in Argentina, however, that nowadays have they question themselves according to the financing because they have a lower rate. So in this case, I would like to mention or to ask how the artificial intelligence can interact with this kind of systems to continue to provide continuity, or to continue with this idea that they are to be systems of distribution, or also with solidarity, but based on the laws on the 80s. So what will happen with artificial intelligence if while we are progressing with the ages and the changes in the life expectancy, we should have a continuous upgrading in the requirements to access to a certain benefit, for example, for the retirement or pension. Sí, this will be my question.
Por favor, Jenny Gómez, puedes hacer uso de la voz y darnos tu pregunta.
Okay, Jenny Gomez, could you please ask your question?
Jenny Gómez.
Jenny Gomez?
Bien, en su defecto, Raquel Navarro. Raquel Navarro, puedes
Okay,
hacer uso.
then we can just pass the floor to Raquel Navarro.
Hola.
Adelante, Raquel, te escuchamos.
Hola,
Please go
una
ahead, Raquel.
pregunta sobre si
I would like
existe
just to ask if there are,
existen ya por parte del Banco
if
Interamericano
they by the Inter-American Bank or from other institutes,
que vayan
if there are some certain incentives by the countries that can cover certain recommendations for digitalization of healthcare, the usage of artificial intelligence, because once, if we work within these institutions, we have find some other initiatives to be adhered to. So it's difficult just to continue, to have follow-up, to continue them, to implement them.
la población derechohabiente, a la población que va a recibir esos servicios y los pone en un
So it's important just for us just to provide this for the beneficiaries. So we should choose from other things or which is process that were not able to be implemented before. So these authorities, they don't accept this. This is the main reason.
De acuerdo, muchas gracias, Raquel. Si hay
Okay,
alguno
thank
de
you
los
very much, Raquel.
panelistas quiere,
In any of the speakers or panelists want to answer this question, please go ahead.
Yo con respecto a la pregunta anterior, en la parte de pensiones, creo que lo más
In regards to the pension part, the important thing is just to have certainty on who are the beneficiaries and what are the histories. And of course, just to have the information, even though they are benefits that are addressed to people from many years ago. However, we should be certain what will be their healthcare history, and of course, what will be their profile, the profile for chronic diseases. So we should follow up on people, and of course, this opens the door because many years ago it was more expensive than today's implementation. So in this case, we are working just to provide individualized attention or service. However, just to have the certainty on who are the main pensioners, the benefits that they are entitled to receive, we can just avoid the duplicity of the process of the data. And this is one of the advantages on the usage of this technology, of course. Well, I'm sorry, we also have another tool that is very useful just to actualize the coverage of the pensions for the quotas of Social Security. So either for the private or the public sector. And the usage of great a number of data, this will allow us to avoid frauds. And of course, just to identify the people that are circumvent with their payments, their monthly payments. But also this allows us just to recover or to have a better recovery of the pension systems. And I only want to add that for the international organizations, because I work in the Worldwide Bank, in a direction they have a bid programs, and all that has to do with the digital transportation is supported by these working lines in different countries. So within the public sector, of course, it's different because most of the public policies are just for all the implementation for all other systems, either for the private or public sector in the part of viability or reliability or everything that has to do with the API of work. They are all detailed in the private sector, however, they are also used by the private sector. And this process is supported by financing institutions or organizations. Thank you very much, Ms. Marina, for your intervention. And now I will pass the floor to the participants in the virtual chat. And Mr. Carrasco has provided us with his time just to answer the whole question, just to cover almost the all questions. Okay, I will pass the floor to Antonio Tipan. Please go ahead. Good afternoon.
Escuchamos con un poco de eco. Antonio, si puedes silenciar desde tu computadora si estás viendo el... A ver,
Buenas tardes a todos, ¿ahí me escuchan mejor?
Good afternoon, can you hear me now?
Todavía te escuchamos con eco, pero... sí, listo. Adelante.
Yes, we can hear it much better. I'm sorry, I'm just using the Antonio Tipan, which is our actuary actuary here. However, we welcome here for the Ecuador institutions. Do you know a good practice to suspend the surveillance control? Each year, for the month of the birthday of each person, they have a super nutation, a control for to know if they are alive still. So we want to intervene actively with artificial intelligence in our institution, of course, and that is why we wanted to ask you this, because we are part for the Oliver group. However, do you know any practical system just to cover this in a more in a better way? Okay, now Evelyn Tosa.
Evelyn.
Buenos
Creo que
días.
no. Adelante, adelante.
Bueno, mil disculpas, estoy con el link de Evelyn. Un gusto.
I'm sorry, I'm with the Evelyn Tosa link. I'm very grateful to be here from Ecuador. And there is a very important topic here. Nowadays, we have the artificial intelligence because artificial intelligence already live with us, and for the future will be a greater step within the Latin America population and for the world. What I would like to ask you, in the CIESS, is there any specific artificial intelligence area? And if this area collect all the Latin American information in the world to know what good practices or what artificial intelligence activities are being implemented, because it's not only an informatic topic or the actuary topic. This includes from the management, of course, that this will provide it with a great information if we manage this correctly, because this is not an electronic tool. This is not a chatbot, but it has to do with something else. So in this case, it would be very important that the CIESS, due to the collection of information, can provide a depository for all the Latin American institutions can contribute and to collect this information and to know which parts are useful for their processes. Thank you.
Bien, no veo más manos virtuales levantadas, entonces leeré una pregunta más del chat y hacemos la ronda de participación con los panelistas.
Okay, so let me just read one question in the chat and then we can continue with the answers.
A ver, esta pregunta la ubico para el doctor Oliver Azuara. ¿Qué pasaría si los datos...
Okay, this question is for Dr. Oliver. What will happen with all the information that are provided for the artificial intelligence are fraud or are not correct? These affect the quality of the information? Okay, so we can just cover this session and then we can proceed with some other 3 questions. And of course, the survival control has to do with the interoperability of the civil systems, in which there is a certainty of the the people that have been passed away.
de manera casi que en tiempo real sobre
And
cómo
of course, this is being provided in a real time.
haciendo para evitar que
And just to know that the people that are dying in without making payments for the people. So in this case, we can have a permanent information for our systems. In terms for the grown data, of course, there are still many terminologies just to know what the quality of the data is. Because as you know, the data is the center of this. The most important thing is just not to consider a process or service without a authorization or previous authorization. As I mentioned at the beginning, if we have this situation, this might have or this might provide confusions or not desired confusion because these processes and algorithms should have an advanced analysis. So there is not a unique solution. However, we have the appetite from different providers to integrate different results or predictive results. So I think that the most important is that just to have the certainty that the information in the majority of the information can be basic, and before it providing any service or providing any analysis that may have a grown or important effect within the patrimony of the healthcare of people.
Doctor Oliver. Una pregunta para la maestra Ridao. ¿Cómo puede la inteligencia artificial
Okay, one question for Ms. Ridao. How artificial intelligence can transform the disability and evaluation system will be the main role for the physicians when they predict the efficiency and just to be more efficient in the laydowns or the layoffs of the meetings. It's a good question because there's a lot of things that can be transformed within this field. I will say that initially the early attention and of course with the follow-up with the diagnostic, the assistance in the diagnosis. As we say, the automatization of processes, the customization of the treatment. I'm thinking because there are a lot of things. However, while we are progressing in these processes and while we are improving, as I mentioned previously, the OPS was recovered or was processing by the human talent because we work with health. And of course, we cannot fail. And in other words, they should be managed or supervised by humans. And I'm not expert in the social security topic. However, a part of this question, I think I wasn't able to incorporate this answer as a whole for this question. However, I think that there are a lot of things that should be considered in terms of disability. Of course, the communication with the patient, because the language, as I mentioned, is something that has been transformed, and artificial intelligence is being transformed. And the artificial intelligence is being incorporated rapidly. So I think this is all the aspects that should be considered and the ones that should be transforming for our day-to-day progressing in disability field. Okay, and there are some there is another question that we can just generalize. And the question is by Elda. What is the status or what is the status of the superior education in terms of the digitalization knowledge and in terms of the artificial intelligence in the region? Specifically for Social Security, however, we can just focus in regional terms. And what would be the status in terms of training? Okay, basically, this is what I'm expert on in the Faculty of Medicine. This is not linked to the Social Security, however, this focuses into the healthcare. However, in relation to the competencies of digital artificial intelligence, we are already living the digital transformation. This not only be focused in artificial intelligence because this is very, very huge. Because we're still being progressing. We're still starting in this. So there are a lot of activities, however, they are nothing already already established for the future of future professionals of the healthcare sector. There are still many things to do for the future. Okay, just in short, I would like to invite you. I will send you a link for which you can find the classification by country on the technological skills that are very important for each sector. And I think also in the presentation of Rodrigo, you will find some other important things. And of course, we are still very, very, very low. We don't have any progress, important progress in this. It's not that easy because we have to invest a lot on this sector. However, we have a great opportunity to continue working on this and to get and to leverage these technologies. Thank you very much.
Maestro Rodrigo Durán.
Okay, Mr. Rodrigo Durán.
Yo creo que estamos bastante atrasados y preocupantemente atrasados, la verdad. Al menos desde nuestro punto de vista, la inteligencia artificial como una
In terms of artificial intelligence, we are behind the progress because this may be constituted as a vital tool for the digital development of many countries, or in the way in which we produce or we continue working in our working field. It's important just to know or to learn from the other countries how they operate with artificial intelligence. And of course, in the research of identify where will be the majority of the degrees in Latin America don't cover or don't provide tools for the development of the knowledge on this field. So we have the need to continue working in the continuous education for the population. However, there is a space in which we still have greater opportunity to develop this. And of course, we have risk and the backward or the delayed progress on these sectors for the digital transformation.
Qué pena, perdimos la conexión en los instantes en la intervención del maestro Rodrigo Durán.
My apologize. We just lost the connection. We lost connection while you were talking. Could you please just conclude your intervention, Mr. Rodrigo? No worries.
Bien, pues muchísimas gracias.
Okay, thank you very much.
Rodrigo Durán Rojas.
Oh, thank you very much, Mr. Rodrigo Durán Rojas, to Ms. Marina Ridao and Dr. Oliver Azuela for your participation in this important session. And just to resume and just to get into some of the questions that were concluded or adding into the CIESS, in the Inter-American Center for Social Security Studies, we have a repository because we have a greater number of information that we are still working on. And of course, this lack of information should be met. And this is the main objective of this session, just to gather together with experts to start talking and just to provide the information about the gap into the learning process in different sectors. Thank you very much for all the lecturers to help us and to support us into this great task and great work. And on behalf of the Inter-American Center for Social Security Studies, we thank you for your time and your opportunity to be able to talk with us. And due to the number of the questions, we face many digital issues. However, we will provide this information for you, this question for you to answer on the topics. Thank you very much again, and have a great day.
Gracias.
Thank you very much.